Jessica, your Pulp Nature co-founder, and I'm sitting here in my New York apartment, kitchen / living room with Ihotu, who is going to be doing some prenatal yoga with me today, which I'm really excited about. Some of you may know I have multiple sclerosis, but I'm also 34 weeks into my pregnancy, and I'm getting a lot of anxiety about labor. So we are going to do some stretches today. She's going to work with me to do some breathing, and hopefully it will make my labor a more, I don't know if I would say enjoyable, because I just feel like that's not the right word, but it will make it easier for me to get through. And as you know, with multiple sclerosis, I definitely want to get right back to, after the baby is born, get back to my normal routines and exercise to make sure that my body is still in great condition. So if I do have a relapse, hopefully the recovery will be much more quick. So we're really excited, I'm really excited, and we're going to get started.
My name is Ihotu Ali, and I'm a certified birth doula and yoga instructor and massage therapist in training. I came over to do some prenatal yoga with Jessica.
I'm so excited. So excited.
And
this baby is coming out soon, and I've watched a lot of videos, and they always have the mom's legs like pushed up to here. Those videos where they're like holding your feet and your legs are like this. I'm always like, can I get into that position? I need to stretch.
Right,
yes.
Something
I need
much.
to just get my body ready. We only have a few more weeks to go.
During pregnancy, the muscles and the ligaments can get very loose, and sometimes you have cramps or kind of pinched areas because you're too loose, sometimes you're too tight, and so there's just a lot of kind of shifting and changes in the body. So it's nice to do yoga to work on straightening your spine, having good posture, and just doing the same positions and movements that will help in labor too. So today with Jessica, we are going to be doing some breathing exercises, some gentle stretches, especially for the pelvic area, and some movements that she can use during labor, and also for kind of bringing her body back after the baby comes.
We all know how important that is, the body back afterwards. We want that to happen.
Yes. I think as a doula, I see a difference between women who do practice yoga, or at least do some kind of preparation and body movements before labor, especially in terms of being calm during the labor, so having a really good rhythm of breathing and being able to kind of find a center and peaceful place within their body that can really help. Also, just in being able to use those, especially the pelvic movements and circling that we'll do, that can be great in shortening the labor, in reducing pain, and really kind of getting back in touch with their bodies after birth. So the first thing we're going to start with is just some basic breathing and some gentle movements to open up the body. So Jessica, I'll just have you take a deep inhale breath. And when you're ready, let that go. Again, inhale. And let that go. Just continue breathing on your own, making sure that your jaw is relaxed, your face is relaxed. Shoulders are soft. Inhale. We just begin with breathing exercises to really bring our focus inward. Something that can be used during labor, just to get through a stressful moment. A lot of kind of the philosophy behind yoga is just about bringing your attention back to the breath as a way of neutralizing any other feelings in your body or in your mind. So just keep breathing. We'll just take the head around in circles to the right. Very gently in, keeping your spine straight, lifting out your shoulders, letting your shoulders stay soft and your face soft. You start to open up the neck. Perfect. And then switch to the left side. Circles around. And stick with your breath. So in the way that contractions can feel like this kind of wave that comes in and out, your breath is also this internal wave, this repetition you can follow. And take your shoulders up. And circle them back. If you have any tension, just letting it go. And shoulders, take them forward in circles. Alright. And stretch up the top. And let it go. Holding the arms up again. And go to the ceiling. And you can clasp your hands, palms facing up. So you just get a nice stretch through the shoulders. And you can do kind of lift up the right arm, left arm. Let's stretch. And then bring the arms, bend the elbows so the arms come right behind the neck. Not pressing on the neck, but just kind of laying there. And then we're going to lean to the right side or either side. Just so you feel that stretch along the opposite side. And switch to the other side. Yeah, feel that stretch along your right side. Keeping the spine straight. Alright, and keep your arms back down. And then this is you can give yourself a little hug. Grateful that you came for yoga and set this up. Yay! And this actually has a purpose. You're gonna bring your arms right here, right kind of below your collarbones. And then feel if you can breathe into that space where your fingers are. So when you're pregnant, you don't want to arch your back. You know, cat-cow, there's a lot of arching. We're just going to work with rounding the back, so you don't want to put extra strain on the back. But we can, instead of arching, we can just kind of breathe into that space. Under your collarbones and chest. So breathe into that space, lift your spine. Yeah, so breathe into that space, and then on the exhale, we're going to kind of round the back.
Okay, I'm gonna say my shoulders. Okay.
And then there you go, inhale. That space in the chest. Exhale, back. It's just slowly opening up the spine, getting some flexibility and movement in there. And exhale. Do one more. And hands on your knees, and you're just going to make circles around your hips. So start to open up the hip area.
That's pee.
Your ears are big.
That's pee after this one. But she's like, whoa.
Yeah, so she's so this is kind of spinning her. Like this is the you know about the hip circles.